Assalamu alaikum, Dr. Minhal.
Walaikum salam.
Thanks for joining us today.
Thank you for having me.
Could you give us a brief introduction about yourself and your occupation?
Sure. So I'm a general dentist in the Houston community, and I've been practicing for about almost a year now. I graduated last year in 2020 from UT School of Dentistry here in Houston. So I'm working around the northern Houston area right now.
What made you choose this occupation?
So I chose it actually when I was graduating high school, and I was always passionate about the medical profession, the health profession. I was actually between being a medical doctor, a physician, or a dentist. And the reason why I ended up choosing dentistry was because I looked around the community. At that time, I felt that there was very little to no dentists in my community, but an abundance of medical doctors. And so I felt personally that I needed to, check out the profession, see if I was interested in dentistry. I went and I shadowed dentists, I did my research, and turned out that I loved the profession and I wanted to pursue it for that reason of being able to help out the community.
Now, there may be several students in the community that are looking to go into dentistry. What advice would you give them?
Well, one big advice I would give them is that, make sure you actually love the profession for the profession itself. Make sure to shadow a dentist, to volunteer at dental offices. A lot of people that are going into the health profession are passionate about helping other people, but there's many ways to do that. And dentistry is just one way. And so you want to make sure that you go to the dental offices and that you will enjoy some of these procedures that you're doing day in and day out. There's a lot of things to dentistry. There's a lot of work that you put your body into it. You have to put your hands and your back and your neck, and a lot of these things go into play that many don't realize. And so it is a little bit of an effort from the provider's perspective. But as long as you go and you volunteer, you shadow at these clinics, and you do it for a good amount of time, and you talk to dentists as well on a personal level, you can meet with them and talk with them and see what they're saying about the profession. And then I think that will give you a really good idea of the profession, and you yourself will have you'll be able to decide for yourself whether you want to pursue it or not.
What kind of investment are students looking at from a time and financial perspective?
So, one of the major reasons that it's so important to study this profession and make sure you're passionate about it is because of those things that you mentioned. Time and financial obligations are huge in this profession, as they are for any other health profession, really. You're looking at about 4 years of undergrad, at least around 4 years, and 4 years of dental school after that, ideally speaking, if you get accepted right after undergrad. So that's about 8 years of education, and then the 4 years of dental school, in terms of the loans that you have to pay, it varies from program to program, but Texas is about the same, about $200,000 if you're paying for your own expenses and things like that at home. It will come around to about $200,000. If you're going out of state, a lot of out-of-state programs are private, so it may be around $500,000, $600,000 for that. So you have to definitely take those things into consideration. If you are pursuing this profession, do you want to stay in state? Do you want to go out of state? And keep in mind the time that it takes, and also the financial responsibility that you will have after you graduate.
What have you noticed regarding dental health in the community?
Well, one major thing I noticed was that a lot of our community members put dental health aside. Sometimes they treat it as it's more of a luxury rather than a necessity. They may not go see a dentist until they get that toothache or until they have problems with their teeth. And sometimes when they do see the dentist at that point, then it's too late, because then the tooth has to come out, or there's other invasive procedures that have to go into it, or a lot of money that has to go into it in order to save this tooth. And so I think that a lot of times the community is guilty of just putting their oral health aside. And another major thing is oral cancer. There's a lot of possibility for oral cancers that can happen, and they may go unnoticed if they're not seeing their dentist regularly.
On that note, what advice would you give to the community at large?
Well, the biggest advice I would give is to make your dental care more of a priority in your life. Just as you do for the rest of your body, your oral health is connected to your overall health. So just as you see your physician, you should see your dentist every 6 months. You should get your exam. They'll do a full exam of the head and the neck, and obviously your teeth and your gums, and they'll take x-rays and they'll make sure everything is looking good, and then they'll also do preventative treatment as well in order to prevent any sort of cavities or things like that to happen in the future. I think it's also very important to brush. Obviously, it goes without saying, but it's important to brush twice a day, in the morning and at nighttime before you go to sleep, and also flossing once a day. I know nobody really likes to floss, but it's one of the major causes of cavities that happen between your teeth. So flossing once a day and brushing twice a day, morning and nighttime before you go to sleep.
What if someone doesn't have dental insurance and can't afford dental care?
So if somebody is unable to afford dental care, then there are a few avenues that they can pursue in order to see a dentist. Unfortunately, dentistry is very expensive, and a lot of the procedures can be a burden on many people. So if somebody is in this situation, then they can search online and see if they find any of these clinics. And if they need assistance or anything like that, they can reach out to me through Link313.org, and I would be more than happy to help.
To reach out to Dr. Minhal, check out his Link313 profile in the description below. This video is brought to you by Link313. To sign up for an account, visit Link313.org and expand your communal network.